fiduciary duty of a doctor. Now, can you see this? Yes, students is this screen visible?
Yes, ma'am.
Yes. So can anybody tell me, like, you can see it on my screen already, but has anybody been taught in your class earlier about this? What are the duties of a doctor, an Indian medical graduate? What services are they expected to provide? Anything? Anybody knows the term fiduciary? You've gone through the question paper, right? When I shared it in the group, whoever had already given their mock exams, I think Mehrunasa and Pallab, both their question papers are shared in the group. So I expected all my students to at least go through the questions and see what all they know, what all they need to learn further. Nobody. I'll start then. So fiduciary duty, it's a 5 marks question. Okay, so I will try to discuss a little bit, like, if you learn and you can just reproduce point wise content, that would be enough for you to fetch very good, like 4.5, 5, even some teachers give 5 marks. Okay, so fiduciary duty of a doctor, so it comes from the term fiducia. Just a minute. Yes. The term fiducia. Fiducia is a Latin term which means trust. Okay. So you mentioned in your first point that fiduciary, this word is derived from the Latin term fiducia, which means trust. Now, what is the definition? Like, first thing, see, in doctor-patient relationship, 3 models have been described. Okay, first is paternalistic model. Second is, so this is not in relation to your notes. I'm just saying, please listen just carefully. First is paternalistic model. Next is contractual model, and the third is fiduciary model. Now, in paternalistic model, the doctor is very professional. He is commanding. It is expected that his patients will obey without any question. So that is mentioned, and if any doctor follows that in that way, it is in paternalistic model. The second model is contractual model. Now, usually this is the case. See, these are overlapping. Okay, so in contractual model, it's like there is a contract between the patient and the doctor, where both work because of their gains. I mean, gains in the terms like the doctor provides medical service or healthcare service to the patient, and the patient provides financial, like fees, in terms of fees or anything, financial gain to the doctor. So that is a contractual model. So whenever maybe the patient is unable to provide fees, the next fee visit, the doctor does not seize him at all. So that's like a contractual model. The third and the most important is a fiduciary model. Now, in fiduciary model, it is presumed, what does a fiduciary relationship mean? Means that one party is superior in terms of certain knowledge, skill, or maybe authority. So as a doctor, you have knowledge, skill, and authority, healthcare related. And the second party relies on you. So you, the first party, who is the more powerful party, has the responsibility for the welfare of the second party. So this is the fiduciary relationship. This can be used in a doctor-patient relationship. It can be used in a lawyer and lawyer and his client's relationship. So there are many day-to-day interactions with professionals where this relationship can work up. In this case, in a doctor-patient relationship, it is a fiduciary duty creates. See, it's written duty. So duty means there is an obligation. A fiduciary duty creates a legal and and ethical obligation, right? Legal. So these are the keywords which you need to mention. This is there in the definition: legal and ethical obligation, where the doctor must act in patient's best interests. by placing patient welfare above personal gains. So these are the terms which you need to mention. At least mention it's a legal and ethical obligation where the doctor acts in patient's best welfare, best interest, and it places patient's welfare above his own personal gains. And what is the nature of relationship in such case? It is trust. Just a minute. It is a relationship of trust, confidence, and reliance. So these are the key terms, right? Trust, confidence, and reliance between doctor and a patient, right? Next slide. Core components. Now, in core components means in the notes only, in your answer only, you will go over to the next section, which are the core components. In core components, you will mention, see, L, C, C, C. So there are 4 duties. Duty of loyalty. Right? What happens? Patient, where the doctor prioritizes patient's health and well-being over personal and professional gains, right? This is the first duty. The second is duty of care. Duty of care. In this case, what happens? The doctor provides competent medical treatment according to accepted professional standards. So it is a standard-based treatment, right? The third is confidentiality, right? Here, the doctor is responsible for protecting patient information and medical records, means maintains privacy of medical records, right? And the fourth is informed consent, basically it is. This case, the doctor ensures the patient understands all the possible treatment options, the risks, and whatever, like, about his diagnosis, his health concern, the risk, and the alternatives before making decision as to whether he wants to take, like, say, suppose if the patient has cancer, right? And the doctor communicates properly. He informs, provides information first, and then takes a consent. Whether he wants to undergo chemotherapy, or like maybe say this is, if you undergo chemotherapy, so and so the probability of survival is this. If you undergo debulking surgery, the probability of surviving is this. So these options are available to, even for chemotherapy. See, so many drugs are available. This would cost you this much. This would cost you 1 lakh. This would cost you 2 lakhs. This would cost you 5 lakhs. But this is a better. So based on his financial capability, once he gets an understanding of all the options, he makes a choice that yes, I will go ahead with this particular treatment, right? So the core components, just if you need to mention the 4, remember the 4 terms: LCCC, loyalty, care, confidentiality, and consent, right? Informed consent. The next is key obligations. The next subheading will be key obligations. Just see, I have already written the important words for you. First is avoid conflicts of interest that can compromise patient care. Now, what do you mean by conflict of interest in this case? I'll just, the first is, say there is this doctor who gets, like, who has some role, is a stakeholder or has some stocks in a particular financial pharmaceutical company. So if, say, he is prescribing that particular drug, maybe which is an expensive drug, and there are cheaper generic alternatives which works equally well, but he is only for personal gains, for conflicts of interest, he is providing so that the company benefits and he will also benefit somehow. So this is a conflict of interest. So this is what a doctor should avoid, right? The second is disclose financial relationships influencing treatment recommendations. You all know, right? So if, say, you are referring a particular patient to, referring the patients to a particular lab, go to lab ABC, where you will do your x-rays and your blood tests. So what actually he does not say that he is getting some commission because of referring patients to that particular laboratory. So ideally, a doctor should not indulge in such practices. So, and even if it does, there should be a disclosure that I want you to say receive take this particular drug, but you must make it a point that yes, I receive funds for research from that particular company, but right now it is the best option for you. Maybe if you place yourself in that way that yes, there are no other better alternatives, this is the best option, and I think it will work for you, but you disclose it. So what he should not do is he should disclose, he should actually not indulge in such practices, right? The third is honest communication. So this what I told you, that the patient, the doctor provides honest, accurate medical information without any deception, right? That say ideally what is a bad practice, that a doctor will say that I think you are fine. I mean, in a cancer patient, he just tells that take this treatment and you will be fine. So he misses all the communication. Ideally, he should be telling that this is your case. If you take this drug, your probability of survival is this, whatever the alternatives are. So the doctor should be providing an honest communication. The fourth point is respect patient autonomy and decision making capacity, just the one that I said earlier, that he will provide or give him a complete understanding, and then he will take his decision as a regard. He can provide his suggestions. Maybe he can tell, I think this is good for you, but he leaves this decision on the patient. So these are the key obligations. The final is maintain professional boundaries. So what do you mean by maintain professional boundaries? Anybody? Anybody? Okay, boundaries. When I say boundaries, it is like keep yourself professionally limited. Means ideally a doctor should not indulge in any kind of affair, or maybe some other kind of with his patients, whatever be it. He might ask him to do any maid kind of a job in his home or something. So it should be limited like a doctor and a patient. He should not take advantage of the patient for any of his or her needs, right? So one should maintain professional boundaries. The now, what are the legal implications? Suppose a doctor breaches his fiduciary duty. So what all can happen? The first thing that can happen is professional. If reported and found guilty, he can there can be professional disciplinary action taken against him. In this case, he can lose his medical license, suspension, revocation. Can be revoked also, right? And he might need to pay penalty or damages to some party. Maybe he does a surgery and he makes a mistake in that surgery, which could have been avoided, and it was because of his own fault. So it can lead. He might, and there's a case against him. There's a civil lawsuit. So he might need to pay penalty and damages, right? And the third is if there is something criminal, like if it is a serious fraud or a misconduct, a serious misconduct, he might even be sued with criminal liability. Right? Right? And the last is practical application. So I have left it for you to read. Just very simple, whatever we have discussed earlier, you just rewrite in a different way. That is, a doctor should provide his medical recommendations based solely on the need of the patient, right? And he should refer wherever he feels that he is not competent enough. He should refer to specialists rather than keeping the patient to himself and carry on with maybe wrong treatment or not potentially ineffective treatment, right? So if needed, he should be referring to a specialist. Third is he should avoid dual relations. As I said that there should not be anything apart from a doctor-patient relationship, apart from a healthcare provider and a healthcare receiver kind of a relationship, right? So he should avoid that to be free from any kind of suits or anything. And the fourth is he should be transparent about treatment outcomes and medical error, right?